I'm going to go through the Medicare and You Guidebook 2019. And this is every piece of Medicare that you need to know. So whether you're coming into Medicare at age 65, you're retiring, you're already past 65, lots of questions, lots of answers. So I'm going to go through it right now. Stay tuned. Okay, we are going to go through the entire Medicare and You 2019 Guidebook. This comes straight from the horse's mouth. Center of Medicare Services puts this out every year. Has pretty much every piece of Medicare covered. So we're going to discuss it, and I'm going to walk through it with you. So that way you'll have an understanding of what it actually means, and you'll know how it relates to you. So that's what we're going to do. And if you stick with me, I'm going to show you where to find a lot of other information that you're going to need coming into Medicare. First thing we need to do is, if you do not have this book, and Medicare usually sends it out when you're 65, but if you do not have it, you can go right to my website, MedicareOnVideo.com. If you go up into the top left into the Resource Center, it'll drop down, and you want to choose Guides and Forms, and it's going to bring you into Guides and Forms, and you can see right here is the Medicare and You Guidebook. If you click on it, it'll download right onto your computer, onto your iPad, whatever it may be. It's great to have it. Just keep it on your iPad. So go ahead and download it, and we're going to walk through it pretty much page by page. I'll show you, I'll try and keep up with page numbers and things like that to make it easy as we go. So let's get right into it. And if you stick with me at the end, I'm going to show you where to get a lot of other information that you're going to need either now or you're going to need later. So make sure you know where to find the stuff. So in the beginning of this guide, it starts off talking about you're getting a new Medicare card. Well, if you're coming into Medicare, you don't have a Medicare card yet, so you're likely going to get the new Medicare card. And the biggest difference on the Medicare card, it used to have people's social security number on it forever, which is obviously ridiculous. And so they finally changed it and put a random number, which may make it a little more complicated when you need that number to find it. But you should get the new card. If you don't get the new card will be right behind it, because it's almost through that whole phase on replacing the old cards. So getting started, if you're new to Medicare, and again, we're going to go through this piece by piece. I'm going to kind of jump around a little bit, but I'll try and keep it all together so that you understand it. You know, you need to learn about your Medicare choices. You need to find out how and when you can sign up. And if you already have Medicare, you don't need to sign up each year. And the Medicare open enrollment period does confuse a lot of folks, and I'll discuss that as we go through the annual election period, which comes along in October through December. It's for certain things, and we'll get through that when we get there. So you can see here, you can mark your calendars with these important dates. And again, this is primarily related to Medicare Advantage Plans and Medicare drug plans. So when you come into Medicare, you have two different ways you can go. You can go original Medicare, generally with a Medicare supplement plan, or you can choose to go Medicare Advantage, which kind of rolls everything into one, and then you kind of run through an insurance company instead of running through Medicare. So I'll explain all that to you as well. So the timelines on this stuff, October 1, you start comparing coverage. So this is really if you're on a Medicare Advantage plan, because a Medicare supplement plan, you can change anytime you want. So there are no time limits on Medicare supplements. Confusing already, I know. So Medicare Advantage is an open enrollment period each year. So from October 15th to December 7th, that's when, if you want to change your Medicare Advantage plan, you have to make your choice. So you have to make your choice between October 15th and December 7th, and then it's going to go into effect on January 1st. So you got to choose way ahead of time, but it's not going to take effect till January 1st. And then if you messed it up and you still want to change, there's another period right behind that from January 1st to March 31st, which still allows you to change your Medicare Advantage plans. So keep that in mind. And keep in mind, with all this stuff, if you get confused, that's what we do, is we help. So you certainly want somebody on your side. There's no cost to use me to help you figure everything out. So I'm an independent insurance broker. I help people primarily with their Medicare supplement plans, but I'm happy to help with all of it. I'm going to show you some URLs that I've made that'll make it easier to do the things that you need to do. But let's talk about the parts of Medicare. You have Part A, Part B. Well, what did they do with Part C? There is a Part C. I'm not sure why it's not on this page. Part D. So Part A, it's not as complicated as it sounds. Part A pretty much covers what goes on in the hospital. So it's inpatient medical care. Part B pretty much covers what goes on outside the hospital. So outpatient medical care, doctor's visits, physical therapy, things of that nature. And Part D is prescription drug coverage. So this right here, A, B, and D, would be considered original Medicare. Part C is Medicare Advantage, which kind of takes you away from original Medicare and again runs through an insurance company instead of through Medicare. So when you have this original Medicare, A, B, and D, you'd probably also have a supplement plan that covers what A and B does not. So we'll also discuss that as we get there. So here we go with our two options. And like I say, you kind of have two different roads you can go down. You can either stay on original Medicare or you can go on Medicare Advantage. And really the big difference between them is original Medicare gives you a little more freedom and flexibility. Doesn't have any networks of doctors or hospitals. You can go to any doctor, any hospital in the country that takes Medicare. Medicare Advantage plan's a little more restrictive. So you do have a network of doctors. You have an in-network type scenario where you choose doctors and hospitals that are in-network. And if you travel and leave your general area very often, it can be a little complicated because your network is generally where you live. So it kind of just depends on what you're more used to. So Medicare Advantage has different levels, goes from an HMO type environment on up to a PPO type environment. And original Medicare is pretty much a straight out PPO. You can go to any doctor, any hospital that accepts Medicare. So you can see on original Medicare, you have A and B. That's what original Medicare is. You can add a drug plan to it, and you can add a supplement to it. And I can tell you, if you have A, B, D in a supplement, not that expensive, and it's super good coverage. So it really is almost too good a coverage where your out-of-pocket cost for the year on the medical side is as low as $185. So that's your max deductible and your max out-of-pocket on the Medicare, on the medical side. The drug side's a little more convoluted, so they've kind of made that a more complicated scenario, but we'll talk about that in a little bit as well. Medicare Advantage plan, it depends on which plan you choose really, because you can have as much as a $6,600 out-of-pocket on Medicare Advantage plan, and they do include some other things like some will include dental, some will include the cost of your Part B. Some can have absolutely no premium. And, understand, and definitely when you're looking at that stuff, in the back of your mind, understand you get what you pay for. So the lower the cost, kind of the more restrictive it will be. So an HMO type plan may very well have no premium, but you're going to need to get referrals to go to specialists, and it's going to make you jump through a lot more hoops than you normally would. So that's your first big decision on which avenue to take. So original Medicare versus Medicare Advantage. So you can see as we go down the list, original Medicare, you can go to any doctor that accepts Medicare. And that's, to me, the most advantageous thing is, and again, I don't know why they call Medicare Advantage, because to me, it's really not an advantage. It's more of a disadvantage because it's going to take away some of your flexibility. So you can see in most cases, you'll need to use doctors who are in the plan. Sometimes an emergency may happen and you can use out-of-network stuff, but it gets complicated. Costs. Original Medicare, Part B, you're going to pay your Part B premium, which right now is $185 a month. On both of these, you're going to pay your Part B premium, which is $185 a month. So under original Medicare, Part B is pretty much 80-20. So it's going to cover 80% and you're going to be responsible for 20%. And then if you go into the hospital, which it gets into Part A, probably on the next page, there's a deductible in the hospital. But that's why you would get a Medicare supplement plan to cover what A and B do not. So pretty simple. So you have A and B, there's some out-of-pocket expenses on A and B. Supplement takes care of those out-of-pocket expenses. There's no yearly limit on what you pay out-of-pocket, but it is limited. So there's really, it's pretty black and white. You don't have an open hole as long as you have a supplement. If you didn't have a supplement, then that 20% does not have a stop on it. You can buy supplemental coverage to help pay for your out-of-pocket costs, like your deductible and your 20%. On Medicare Advantage, you got to pretty much go to the doctors that are in network. Out-of-pocket costs vary, and again, they have different levels, and it'll be based on how much they charge in premium for the most part on what your out-of-pocket costs may be. You may pay a premium for the plan. Some have no plan premium. So again, just keep in the back of your mind, get what you pay for. So if you go into a very low cost Medicare Advantage plan, just be prepared that you understand exactly what you're getting into. Plans have a yearly limit on what you pay out of pocket. Some of it can be pretty high, so you need to understand that as well when you're looking specifically at a Medicare Advantage plan. What is my maximum out of pocket each year? And you can't buy or use separate supplement coverage, but some plans have lower out of pocket costs than original Medicare. So you can't put these two together. You're picking one or the other as you go. So again, that's your first choice: original Medicare, Medicare Advantage. So coverage: original Medicare covers pretty much medical insurance kind of stuff. So if it's medically necessary and your doctor says it's medically necessary, pretty much I don't hear too many people complaining about Medicare not covering something that would be standard medical coverage. You can join a separate Medicare prescription drug plan. Now, I do hear people complain about that sometimes because the drug plan is a little crazy. It has different levels of benefit when you have it, and you need to understand, especially if you take a lot of prescription drugs, you need to understand how to do it. And with drug plans, they're not standardized like Medicare supplement plans, so they're completely different from each other. So generally, I find it best to do it yourself, to find, and Medicare has a very good tool. You put in your prescriptions, and it tells you what the best drug plan is in your zip code. And I have a video that walks you right through it. You can go to drugplanvideo.com. If you go to drugplanvideo.com, brings up the video where I'll walk you right through on Medicare site, show you how to find the best drug plan. And really what that does is it makes it so that there's not somebody selling you a drug plan that may not be the best drug plan for you. It gives you the ability to make sure that you get the right one for your situation. On Medicare Advantage, they can cover prescription drugs in Medicare Advantage. Sometimes, it depends on the plan and whether it's on tier 1 or tier 2, tier 3, if it's in their formulary or not in their formulary. So it takes some real homework to make sure if you take a lot of prescription drugs and you're going to go Medicare Advantage, that you get the right Medicare Advantage. It's almost like picking a drug plan. You got to pick it within your Medicare Advantage plan. So looking down at the bottom here for travel, this is a pretty big deal. So with original Medicare, it generally does not cover care outside of the U.S. However, Medicare supplement plans do. They will give you a fixed benefit for out-of-country coverage. On Medicare Advantage, you really don't have that option. It does not cover care outside of the U.S. So if you're retired and you're traveling and you're in Mexico or Europe or Ireland or wherever you may be, and you have a problem, it can be a real problem. So with original Medicare, if you have a supplement, you got a pretty healthy amount that is covered. So that works in your favor. Medicare Advantage, you'd probably looking to buy some kind of international health insurance, which can also kind of complicate things as you go along. So topics as we go through, and you can see there's a lot of pages here. We're not going to go through every single page, but we're going to just kind of breeze over some of them, but we're going to get specific on a lot of them. So we want to make sure we understand that. So signing up for Medicare. Some people get Part A and Part B automatically. And I'm going to just kind of paraphrase what things say here and tell you how it is. If you are currently drawing Social Security, so if you took Social Security starting at age 62 and you're now turning age 65, your Part A is going to start on the first of the month that you turn 65. Your Part B is also going to start on the first of the month that you turn 65. They're going to send you a postcard saying, unless you tell us not to, we're going to start your Part B on the first of the month that you turn 65. And the reason for that is if you're already drawing Social Security, they assume you're not working, that you're already retired. So your Part B is going to start at the first of the month of age 65. Now, if you are not drawing Social Security, if you have not elected to take it when you turn 65, your Part A is going to start automatically. So Part A starts automatically. And then Part B, you need to initiate. So you need to get online or call Social Security. And that's one of the other kind of crazy things. You got to do all this through Social Security, not through Medicare. And I have a link that makes it easy for you to do that. So if you need to sign up for Part B, you can simply go to www.startpartb.com. And what that does is it takes you right to the page on Social Security where you do that. So feel free to use that when it's time. And you want to do this early. There are some pretty hard lines of time that you need to get this all done in. So do it 3 months before you're going to turn 65, 2 months at the latest before you turn 65. Get it done, get it in place, get it over with, and just, make sure it's easy. And that's what we look to do, is keep things simple. If you need help, give me a call, send me an email. We'll walk you right through it. It's really pretty easy to do, but you got to do it. So that's kind of getting it going. And I get people all the time that miss their timeline. And when you miss your timeline, it's a big deal. It is a big deal, because you will then be delayed and you may not have any health insurance for as many as 3 or 4 months. So get it done early and get it done when you're supposed to do it, and we're happy to help you do that. Some people have to sign up for A and B. Like I just said, it's going to tell you, it's a little different if you work for the railroad. So if you want to read through there, if you do work for the railroad, for some reason they separate out if someone has end-stage renal disease. It's a little more specific in that situation. Or if you live in Puerto Rico, or if you get benefits from Social Security or the Railroad Board. So you're welcome to look through that. And again, if you have any questions on that, just let me know. If you're not automatically enrolled, when can you sign up? And it's called your initial enrollment period. So you can sign up 3 months before you turn 65, the month that you turn 65, or 3 months after you turn 65. But do not wait till after you turn 65. It gets complicated. You need to do it within those 3 months before you turn 65, and then it just works super easy, super simple. Special enrollment periods. There are some different scenarios that will give you other rights to do it, but again, gets a little complicated and takes a little more personal attention. So if you feel you are in that scenario, give a call and we're happy to help you with that. COBRA. And this is important. So if you're still working, so understand this, and it'll probably be covered later, but let's talk about it now. If you are still working and you're age 65 and you have terrific health insurance at work, so you don't want to go into Medicare because you're going to continue working, you're going to keep your health insurance. So what you want to have happen is your Part A is going to start automatically on the first of the month of your 65th birthday, no big deal, but you do not want Part B to start while you are still working, while you still have group coverage. And why that is, so we understand it. So when you turn 65 and you come into Medicare, it gives you an open window to pick anything you want without any medical questions. You can choose anything you want. Once you're in Medicare, that goes away. You have to go through medical underwriting in order to choose things. So if you are continuing to work, and let's say you worked age 68 or 72, when you retire, your Part B will then start. And when your Part B starts, it's just like you're turning 65. So you will then have an open window to choose anything you want without any medical questions, and you can put things in place exactly the way you want to do it. If for some reason you stay at work and you stay on your group plan and you started your Part B, number one, you're going to pay $135 a month for no benefit, because it's not going to help you if you're staying at work. If you started it, then it's going to close that window down the road. Now, it is different, and again, we throw in all these caveats as we go. If you work for an employer that has less than 20 employees, that's a different scenario where Medicare then becomes the primary. So if you were at an employer less than 20 employees, you do want to come into Medicare because it's going to be your primary right when you turn 65 regardless. So keep that in mind. And again, just give us a call, send an email. We'll walk you right through it, and we'll make sure everything gets done exactly the way it's supposed to be. So that kind of gives you a pretty good idea. And then what people don't understand also is continuing to work or staying on your group plan, and then 5 years later you start your Part B just like you're turning 65. That's great. There's no penalties as long as you can show you had credible coverage before. So your employer group plan, as long as you had credible coverage, then your Part B starts just like you're turning 65. Now, what folks don't understand, and I don't really understand it either, is COBRA coverage does not count as credible coverage. Retiree coverage does not count as credible coverage. So let's say you retired at age 64 and you got on your company's retirement health insurance benefits and you like it, so you keep it up till age 68. Well, that's not credible coverage for Part B. So when you're ready to come into Medicare and start your Part B, there's going to be a penalty. So you need to understand that as well. So only while you're still working on a regular group insurance plan can you extend it past age 65 without a penalty on your Part B. Hope that clears that up. So different scenarios with marketplace coverage and health savings accounts. And health savings accounts can be complicated as well, because the rule is you can't contribute to your HSA once your Medicare coverage begins. However, you may use the money that's in there after you enroll. So once you start your Medicare, you can't contribute to a health savings account any longer. But you can still, obviously, whatever you've built up in there over the years, use that. You can see here we're now on page 19 of the book, so if you've fallen behind, you want to see where we're going, I put the page number up there every once in a while to kind of keep us on track. So how does my other insurance work with Medicare? And here we go. I just explained all that. So, this is the page that goes through it. If you have 20 or more employees, if you have 20 or less employees, and kind of the way that I just explained it is the way that you want to approach it. But it's really not that complicated, but you got to do it within the parameters or else it will be complicated. So here are some facts to remember. The insurance that pays first pays up to the limits of its coverage. The insurance that pays second only pays if there are costs the primary insurer didn't cover. So that's if you're over 20 employees, under 20 employees, and you max out one of your insurance. It would take a real catastrophic event for that to happen. Not likely to happen. Now, when we have these little blue arrows that say important, we want to read them. So let's see what this one says. If you have Medicare Part A, including coverage in a Medicare Advantage plan, you meet the requirement for having health coverage. You have to report this on your federal income tax. So they're going to tell you got to pay income tax on your Medicare premium that you're getting on Part A. How much does Part A cost? Usually, most people do not pay for Medicare Part A. So if you've been working all your life and you've been paying your taxes all your life, you're covered under your Part A. Now, if that's not the case, you may need to buy Part A. If you have not been working for your entire life, or your spouse has not been working, or whatever the scenario may be, then you may have to buy into Part A. And people who have to buy Part A will pay up to $437 a month for their Part A coverage. So that kind of takes care of that on when to do it. So how much does Part B coverage cost? And this one you need to understand. So the standard Part B premium is $135.50 in 2019. So it's going to cost $135.50 a month. If you're already drawing Social Security, it's going to come out of your Social Security check. Makes it easy to do. You might not be happy about it, but it makes it easy to do. If you are not drawing Social Security, they're going to send you a bill. And they're going to send you a quarterly bill. So you're going to have to pay 3 months at a time of your $135.50. Now, the $135.50 is the base amount. This is an income-driven premium amount. So if you make more than X amount of dollars, you're going to pay more for your Medicare Part B. And I do have a video on that specifically. And I just did one recently for 2019. And it's called IRMA. And just look through my videos on the site. Type in IRMA, it'll bring up that video. If you make more than, I believe it's $85 single or $170 joint, that premium is going to go up, and it can go up significantly. It can go up to $400 and change a month, depending upon your income, and it's income from 2 years ago. So you need to understand that, so make sure you watch that video if you are a high earner, and you might have to pay more for your Medicare. What is the Part B late enrollment penalty? That's when you miss your deadline and you don't sign up for your Part B when you're supposed to sign up for your Part B, and then you want to sign up for it later. It's going to cost significantly more. So let's make sure that we do it when we're supposed to do it. And again, when I just talked about how you're going to pay the premium, if you draw Social Security, it comes out of your check. If you're not, they're going to bill you quarterly for your Medicare Part B. Okay, page 25. Find out if Medicare covers your test, service, or item. What services does Medicare cover? And again, it's pretty typical health insurance. If your old health insurance covered it, Medicare is probably going to cover it. Medicare might even cover it better. Medicare really, really is a very good health insurance plan. You are likely going to be thrilled to death with your Medicare as long as they don't change it next year, the year after, the year after. As long as it stays where it is right now, it's terrific stuff. And you will find that as you go. I have literally thousands of clients, and if I get 2 customer service phone calls in a month, that's a lot. And literally, I don't think I get 2 in a month. So it's wonderful on my side, wonderful on your side. And just as long as you set it up right, then you're going to just go off without any troubles whatsoever. So we just got to make sure we get it set up right. So what do I pay for Part A? We just talked about that. Oh, these are for the services. And you can go through this. You know, it's in the book. If you downloaded it, you're welcome to look through this individually, and talks about some of the different things that are covered. And it goes through a whole list of different things. And hospital inpatient care. Let's talk about that real quick. So this would fall under Medicare Part A. If you're on original Medicare and you're admitted into the hospital, inpatient care is going to fall under Part A. And with Part A, you have a deductible of $1,364. So that's a pretty big deductible if you're admitted into the hospital. Now, if you have a Medicare supplement plan, most likely it's going to cover that entire deductible. So it won't cost you a nickel out of pocket to go into the hospital. It's going to cover the entire $1,364. And it runs on a benefit period. So you can have more than one deductible during the year. And if you go in, if you're admitted to the hospital multiple times, you can have multiple deductibles. But again, your supplement would cover them each time, assuming that you have a supplement. So there's some other charges that if you're in the hospital for an extended period of time, but also your supplement would cover that as well. So am I inpatient or outpatient? This is a big deal. And they've changed this recently, really not in your favor. And this is one of the rare instances where you can have some not happy moments with Medicare, is whether you're inpatient or outpatient in a hospital. So I've had somebody before that broke their arm, went to the hospital, and was in the hospital for 3 days. So 2 nights and 3 days they were in the hospital. And they were listed as observation, not inpatient. And when you were listed as observation, it limits you on some other scenarios. Number one, skilled nursing. So Medicare won't cover skilled nursing unless you've been inpatient in the hospital. So if they put you as observation, and this poor lady needed to go to skilled nursing for some rehab, I think for 2 weeks after, and it was costing $350 a day for the rehab and the skilled nursing. So just understand if you're in the hospital, understand if you're inpatient or observation. And then outpatient is completely different. So outpatient is Medicare Part B, where that covers all the stuff outside the hospital, regardless of whether it's outpatient surgery or doctor's visits, physical therapy, things of that nature. Some other stuff in here in skilled nursing facility care. Let's talk about that real quick. Medicare is not designed for long-term care. Medicare is not a long-term care policy. Medicare will pay X amount of days on skilled nursing. And you can see here, you pay nothing for the first 20 days of skilled nursing. Coinsurance of $170.50 for days 21 to 100. So you're going to pay $171.50 up to day 100. And then all costs after day 100 in that benefit period. So the maximum amount they're going to pay for anything is up to 100 days. They're only going to pay 100% for the first 20 days. So big deal to understand that as well, and to absolutely understand that it is not a long-term care policy. So if you have run into or have a relative that is in need of nursing home care for whatever it may be, Medicare is not going to pay for it for long term. So you need to make other arrangements for that type of scenario. What does Part B cover? And again, medically necessary stuff outside the hospital for the most part. What do I pay for my Part B? It's going to start at that $135 a month premium, and then it can go up from there based on your income. And then Part B has a $185 deductible in 2019. So when you go to use it, January to January, $185 deductible, you're going to pay the first $185. Then Part B is going to pay 80%. You're going to be responsible for 20%. If you have a Medicare supplement plan, it's likely going to cover that 20%. It's not likely going to cover the $185 deductible, which is no big deal. Who has a $185 deductible now? So if we have a $185 deductible and then pretty much 100% coverage after that, that is terrific health insurance without a doubt. So some of the Part B covered services, and again, you're welcome to go through that stuff, and I don't think I put all the pages in here, but it's all listed in there for you. And we've talked about travel and kind of how that works. Urgent care, Medicare covers urgently needed care. depend, wherever you are, pretty much, and it's going to cover you regardless on original Medicare because you can go to any doctor, any hospital in the country. Medicare has preventative services that they cover without any cost whatsoever, which is good stuff. So you want to make sure you understand that as well. You have a yearly wellness visit. Now, don't confuse that with a physical. A wellness visit is not a physical. It is simply a wellness visit. Your doctor absolutely should be able to help you differentiate with the things that Medicare does cover, Medicare doesn't cover, 100% kind of thing. And then what's not covered by Part A and Part B. Most people don't necessarily understand that Medicare does not cover dental, does not cover eye exams, dentures, cosmetic surgery, massage therapy, acupuncture, hearing aids, long-term care, concierge care. And, a lot of that's on regular health insurance. But dental care and hearing aids are kind of some of the two big ones. It does cover, it says eye exams, but it absolutely covers cataract surgery. A lot of people wait till they get to Medicare and then go get their cataract surgery done immediately after their Medicare. It usually works out terrific. But dental care, if you have had a history of needing dental care in the past, you'll absolutely want to look into some dental care, and then we certainly have that available. It's pretty simple and pretty easy and not terribly expensive, so it can be a good thing to have. Paying for long-term care, it does not cover it under Medicare. So original Medicare, how does original Medicare work? And again, pretty simple, pretty open, pretty easy. Can I get my health care from any doctor, other healthcare provider, or hospital? Yes, as long as they accept Medicare. Yes. Are prescription drugs covered? No. So you need to get a Medicare drug plan to cover prescription drugs. Do I need to choose a primary care? No. Do I have to get a referral? No. Should I get a supplement policy? Yes, you really should. Now, there are some that don't, but my feeling with the Medicare supplement policy and having original Medicare with a $1,300 deductible in the hospital, 80/20 care, that's not too bad. That's pretty good coverage. The problem is on the 80/20, the 20 has no stop. So if you have just a normal year and you had $1,000 in medical expenses and you had to pay $200 for the 20%, no big deal. But if you have a $100,000 year and you got to pay 20%, or God forbid you have $1 million year and you're on the hook for 20%, that's why you need to have a supplement, because it just puts everything crystal clear, and you're going to be retiring, doing other fun things. You don't want to be worried about medical expenses. And a supplement can be anywhere from $80 a month to $150 a month. So not usually much more than that. So it's pretty easy to have and pretty simple. And again, you need to get it when you first come in because you don't have to answer any medical questions. Later, you would have to answer medical questions. So what do I pay? Your out-of-pocket costs in original Medicare depend on whether you have Part A and Part B. Of course, you would have both. Whether your doctor accepts Medicare assignment, that's a little different thing. We'll talk about it in a minute, the difference between a doctor taking Medicare assignment and a doctor that just takes Medicare. There is a difference there. Whether you have other health insurance, so forth and so on. So it's really just kind of questions on what you have or what you don't have. And then you can get your Medicare summary notices by email. Makes it easy, so you'll get kind of an explanation of benefits. When you go to the doctor, you can see what the doctor billed, you can see what Medicare paid, you can see what your supplement paid, so forth and so on. What is assignment? So assignment means if you go to a doctor and they take Medicare assignment, then they agree to accept what Medicare is going to pay them as payment in full. If you go to a doctor that just accepts Medicare and does not take assignment, then they take what Medicare pays them and they can then bill you 15% or up to 15% more than what Medicare pays them. And it's generally not a big deal, but certainly it could be in kind of a severe situation. But a lot of supplement plans cover what's called Medicare excess charges. So that is what that would be, is Medicare excess charges if they do not take assignment. So you can go into a doctor's office and ask at the front desk, do you take Medicare assignment? And they don't know. They think they do. They might. They'll confuse it with Medicare Advantage. and maybe say no. And so they don't always necessarily know themselves, because it's pretty complicated at the doctor's office as well, with all the different kinds of insurance that they deal with. So, you know, you need to understand it, and you kind of hope to get a clear answer on whether they take Medicare assignment. It's a high percentage that do. 96%, I believe, take Medicare assignment, so it'd be pretty hard to find one that did not take Medicare assignment, but it's certainly possible. So Medicare Advantage plans and other options. What are Medicare Advantage plans? And again, it's like an HMO or a PPO, where it takes you out of original Medicare and kind of runs you through an insurance company, whether it's United Healthcare, whether it's Aetna, whether it's Humana. You kind of go under their control and follow their rules, although Medicare does require that they follow a lot of Medicare rules. But it just kind of limits your flexibility and your freedom within the plan. So certainly something you want to give a lot of understanding to and a lot of thought about how much money you might save. And generally they can look really good on the outside and maybe not be so good on the inside. If you do some Google review search, generally dissatisfaction is almost all on Medicare Advantage, almost none on Medicare Supplement. So that kind of speaks volumes right there. People are very happy making their own decisions versus having to be in a situation where they have to ask permission sometimes to do the things that they're wanting to do. So you can see here the different types of Medicare Advantage plans: HMO, PPO, a private fee-for-service, special needs plans. And special needs plans are for people that have a very significant ongoing chronic condition like diabetes or something that would require kind of special needs. It can work out very well for that. HMO point of service, so it can get convoluted here, especially when you have somebody trying to sell you into one of these and trying to, you know, make the most money they can by selling you what may not be the best for you. But again, you get what you pay for. So the higher the cost, probably the better the plan. The lower the cost, the more restrictive the plan. So if you're looking at something with zero premium that's giving you free dental and free drugs and free fitness memberships and free, you know, it's probably not going to be as rosy as you think it is. And it's great as long as you're not using it. But then when it comes time that you need it, then you find out exactly, you know, where the troubles may lie. So just be careful when you're trying to choose. Medicare Advantage plans cover all Medicare Part A and Part B services. And again, you may have to get special permissions for that, but it is covered. Let's see, Medicare Advantage plans must follow Medicare rules. So they are required to do certain things, but they can also do their own things. So just kind of go in with your eyes wide open. Read the information that you get from your plan. And most people, you know, they read the stuff, it's a marketing piece, so it's going to all sound really good when they get it. And then what else should you know about Medicare Advantage? You have Medicare rights and protections, and then they give you some outs. If you join a plan and you hate it, as long as it's the very first time you did it and you started right when you came into Medicare, then you can get out of it. And a lot of people do that. So just, but that's complicated too. You need some help doing that. Prescription drug coverage is usually part of a Medicare Advantage plan. So again, but it depends on what levels and what they cover and what they don't cover and how they cover and how much out of pocket and deductible, all that kind of stuff. If you had end-stage renal disease, it makes things a little bit different. You can read through that as well. But that's kind of the overview on Medicare Advantage. Your out-of-pocket costs depend on whether your plan charges a monthly premium, and then your deductible, and then really your out-of-pocket maximum. Make sure you understand your out-of-pocket maximum. Original Medicare with a supplement doesn't have much of an out-of-pocket maximum at all. A Medicare Advantage plan can have up to over $6,000 on their out-of-pocket costs. So make sure you understand that. Types of plans, it just discussed that before, and now it wants to discuss it again. So I don't know why they go over it twice. HMO, PPO, private fee-for-service, special needs plans. When can I join or drop a Medicare Advantage plan? And again, this is during the open enrollment period. So if you got into a Medicare Advantage plan and it turned out to be the wrong one, or you don't like it at all, during the open enrollment period at the end of each year, you can make changes. Now, you can come back to original Medicare, But if you want to get a Medicare supplement at that point, you have to go through medical underwriting. So you have to be pretty healthy to be able to do that. If it was just the wrong Advantage plan and there's a better Advantage plan, you can jump around in between Advantage plans during open enrollment period, and that'll take effect on January 1st, the change. So you've got some flexibility there to kind of move around if things change, or if the drug plan changed, or if the doctor that you love left the plan, which also happens quite a bit. Their networks can change quite frequently. So it gives you the ability to get into a different plan if you want, or if you're healthy, you can get back into original Medicare with a supplement. Special enrollment periods, a little different, a little more complicated. If you're in a Medicare Advantage plan, you move out of the area, it gives you some rights to change plans. If your plan went out of business, it gives you some rights to change plans, things of that nature. Medicare supplement plans, so page 69 in the guide. And again, Medicare supplement, it's pretty simple. It's pretty much a PPO, and it's going to cover what Medicare doesn't. And it's whether you take Plan G or Plan N or Plan F. And I have a video, Best Medicare Supplement Plan, that I explain what I think is the way people should go, or at least the choices that they should look at. And absolutely, you need to watch that video to make sure you understand your Medicare supplement choices. But if it were me, and I'm coming into Medicare, hands down, without any doubt whatsoever, I'm going Medicare A, B, gonna have a drug plan, gonna have a Medicare supplement plan. And my overall monthly cost for everything is probably less than $300. So it's probably $2 and change, and just depends on what part of the country that you live in as to where it's going to be on your total cost out of pocket wise. So this is the different chart on choices for Medicare supplement plans. It's too complicated, it's too confusing. I break it down in the other video, Best Medicare Supplement Plan, make it much easier to figure out so that you know exactly what you're doing. What to know about Medicare supplements: you must have A and B, just like on Medicare Advantage. So you always have to have A and B. You pay the private insurance company a monthly premium, and again, that premium is anywhere from $80. Actually, it can be lower than that, or up to $150. It can be a little higher than that if you live in some of the more expensive parts of the country. It covers one person. So far, it's pretty basic information. It's going to cover the stuff that your plan doesn't, and just depending upon exactly how much, whether you choose Plan G or Plan N. And when to buy. The when to buy is when you first come into Medicare, because again, you get one shot at Medicare supplement where you don't have to answer any questions. After that, you have to answer questions. So, you know, if you're super healthy, no big deal. But if you are not, then you're going to be wherever you're going to be without being able to change. So we want to make sure we get it right the first time. How does Medigap or a supplement work with a Medicare Advantage plan? They don't. You cannot use the two together. So a Medicare supplement, also known as a Medigap, does not work with an Advantage plan. Vice versa is the same. Medicare prescription drug coverage, Part D. So if you're staying in original Medicare, probably getting a supplement, probably getting a drug plan. Drug plans are a little more complicated. And again, I have the video, drugplanvideo.com. Is it .com? Yep, drugplanvideo.com, where I walk you through how to get it and how to do it. I have another video that shows you kind of how it all functions, and you need to understand that as well. But again, we'll help you with that. So just give us a call and we'll be happy to walk you through it. And again, we don't sell it, so you're getting a completely unbiased opinion on the right Medicare drug plan, because we're not selling it. We're just going to show you the best one that should work for you. So when can I join or drop a drug plan? Same as Medicare Advantage. So a drug plan runs in that open enrollment period. So if you take certain drugs now and you got a drug plan, and then during the middle of the year your drugs all changed and your drug plan isn't the right drug plan for the drugs that it changed to, then during open enrollment you can change to a new drug plan. So just keep that in mind. Medicare Advantage, Medicare drug plan give you the ability to change at the end of each year. So if your situation changes, it gives you that ability as well. So how do I switch? It's not that complicated. You can go from one to another during Medicare open enrollment. So if you enroll in a new one, it's going to pretty much disenroll you from the other one. How much will you pay for your drug plan? Premiums can run as low as $17 a month up to $35 a month. Depends on when you get it and what deductible you're choosing and overall coverage. And again, it's a little more convoluted, so make sure you watch the video or let us help you walk you through it, and that way we'll make sure you get the right one. And with drug plans, lower premium isn't always the right way to go. So it depends on what drugs you take and how much they're going to pay for those drugs. You absolutely might want to pay a higher premium to get better coverage for the drugs that you currently take. So that's how it all works there with the monthly premium. There's also in a drug plan called a coverage gap, which is more widely known as the donut hole, and then catastrophic coverage. So it has different levels of coverage. There's like 4 quadrants where you have starting coverage, middle coverage, donut hole, and then catastrophic coverage. So again, if you take a significant amount of expensive prescription drugs, you're going to need some assistance figuring out which one is the right way to go. So it gives you the example on how a penalty works. If you don't get it in the beginning, you want it later. And again, that's something that you can walk through if you want to do that. What drugs are covered, again, goes by different plans. So it depends on the formulary. And the goal is to find the right formulary for what you currently take. We obviously can't see into the future what we're going to take. So let's get it right now. And then if things change during open enrollment, we can change as well. So you can also get refills in the mail, you can get mail order, all that kind of stuff. And Part D doesn't generally work with other coverages, so the drug plan you get is pretty much going to be the drug plan that you use. And then there's some other information here on government insurance, so forth and so on. So getting help with your health and prescription drug costs. So if you are lower income or you need help paying for Part B premium or drug plan premium or out-of-pocket expenses, Medicare does have places for you to go. You're welcome to walk right through this. This is on page 83. It shows you where to go to find assistance with the out-of-pocket costs. And they're actually pretty good to work with. So Medicare is likely, might even be the best government-run program that we have. They're actually very helpful, very accommodating, and the benefits are overall very good. The exception might be on the drug plan where it gets a little crazy, and hopefully they're working on that now where they're supposed to start to negotiate drug prices and things of that nature. But obviously we know we pay much more than just about anywhere else in the world for prescription drugs. But Part A, Part B, supplement plan, and a drug plan, and you have terrific health insurance really for the rest of your life. Medicare Advantage can work as well, but you got to understand what you're getting into, and you got to be willing to kind of jump through the hoops to get some extra kind of benefits that you might not have included with original Medicare, but you can still get on the side without any problem at all. So it all works out, and it's all relative. And again, this is one big puzzle that we just got to figure out. If you're turning 65 and you're coming into Medicare, we just got to get it right. If you're going to stay at work, number one, don't start your Part B until you're ready to come into Medicare. And then when you do, we just got to get it right. So just make sure you can send me an email, you can give me a call, you can visit the site. You can see right here, you can get a quote for your Medicare supplement coverage. And I'll give you a little overview of the site right now. Hope you found this helpful, and stay tuned. I hope you found this video helpful, and I'm certainly always happy to help with any questions, any issues that arise, and they always do. So feel free to give me a call or send me an email. You'll certainly want to visit my website. I have a tremendous amount of information there for now and in the future. So just visit MedicareOnVideo.com. Right in the middle you'll see is where you get a quote for a Medicare supplement plan. And this is obviously what I do for a living, is I help people make sure that we get the right plan at the right price with the right company in whichever zip code you're located in. So you certainly want to run a quote on a Medicare supplement plan. You can also get a free discount prescription drug card. And I get really good feedback on this, so you might as well go ahead and download a prescription drug card, and it's likely going to save you some money at the pharmacy. While you're there, you want to go into the Resource Center, and the Resource Center tab is going to drop down, and what you'll find is guides and forms where I have pretty much any piece of information that you need for Medicare right here. So if you need something like the employer form where you're going to retire and you're coming into Medicare and your employer needs to fill this form out, you can download it right on my website and then email it to your HR department, get them to fill it out so that you'll have it when you need it. And you can also get a copy of my book. So you can download a copy of Medicare Made Clear, and I cover just about every topic in Medicare. So it's a great thing to have on your iPad or on your computer, whatever it may be for now. And again, in the future, certainly very helpful to have. Now, you'll also in the Resource Center find the video library. And if you click on video library, it takes you right to my YouTube channel where I have over 100 videos on pretty much everything Medicare. So now we've got so many, it's kind of hard to find what you're looking for. But if you're looking for something specific, just use the magnifying glass at the top, put in whatever topic you're looking for, and it'll bring up the videos that relate to that topic. So it makes it easy to find exactly what you're looking for. So I'm happy to help with any of it, and obviously I'd appreciate it if you'd allow me to help you with your Medicare supplement plan. That's what keeps this whole thing going, and I'm happy to do it, and we will make sure that you get it right from the start. So I hope you found all this helpful, and have a fantastic day.